Hey guys, and welcome back. Today I will share my experience about my emergency medicine rotation. Emergency medicine was my second rotation, and I did this experience at a level 3 trauma center. And to be completely honest with you guys, emergency medicine was the rotation that I was most anxious about. However, over the course of 5 weeks, I did grow accustomed to the emergency medicine lifestyle. Well, except working weekends. Now that I think about it, that should be illegal. Like, the weekends are my Fire Lord, and as the PA avatar, I must defeat weekends for all clinicians so we can bring peace back to the world and have our Saturdays and Sundays free. Okay, maybe getting a little carried away, so back to our regularly scheduled programming. Funnest part of this rotation was definitely doing the procedures such as lac repair and incision and drainage. It's very different than that rubber pad that we had during didactic year, where we practiced our suturing, and suturing on human skin was a different experience for me. But the more I did it, the more I got used to it. What I will say is that no laceration is perfect, and I can attest to this 100% because my first lac repair was something I was not expecting. My first lac repair definitely required some vertical mattress sutures, which I did not practice enough before I went into it. I did put a lot of emphasis on the simple interrupted sutures. So my advice is definitely to practice all different types of sutures, such as your deep dermal, which I've done a lot of, your simple interrupted, your running suture, as well as the vertical mattress. And you can't suture without numbing, so it's very important to just be familiar with the different types of lidocaine, which lidocaine to use in which region, how much lidocaine to use, and how to drop the lidocaine as well. Another important thing are the digital blocks, because there are a lot of finger lacerations. And there are probably hundreds of ways to do a digital block, so just become familiar with one that you feel comfortable doing. And this is something that you'll definitely learn throughout the experience with your different preceptors. And they'll definitely teach you, and you'll become more comfortable doing digital block if you haven't done so already. Speaking of preceptors, I rotated with many different preceptors. And what's good about this is that you can learn different techniques when it comes to procedures, even physical exams, and which labs to order, because each person has a different way of doing things. And it's important as a student just to learn as much as you can and take bits and pieces from each preceptor and make it your own. Knowing your diagnostic tests are very important, especially in an emergent situation, because you want to be able to rule out any fatal or life-threatening conditions. So knowing which labs and which imaging to order is very important. Not only imaging, but you want to make sure you know which imaging is the safest, most efficient, and most effective imaging modality at that time. Reading and interpreting EKGs is also something I did a lot during this rotation. And what's different about this compared to didactic here is that you actually have the patient's previous EKG to compare it to. You know, during didactic year, they always say, always compare to a previous EKG, and now in clinical year, you can do that. Knowing how to read chest x-rays and even going through some CT scans is also something that I did a lot. Luckily, I had the assistance of my preceptor who taught me how to look at different imaging and knowing just the steps and having a stepwise approach to, reading and interpreting CT scans and chest x-rays. So that's something to also become familiar with. It's important to note that a lot of patients do not want to be in the emergency room, and they are very scared in this emergency room setting. So it's very important just to be empathetic and kind to all your patients and just making them feel comfortable. The emergency medicine setting is a very collaborative setting, and during my experience, everyone was very nice and helpful, from the physicians to the nurses, the PAs, the APRNs, and the ED techs. Special shout out to the nurses. Be sure to subscribe to this channel, leave a comment, like this video, and share with all your friends.